Diogo Martins on one of my prior YouTube clips asks about using resources while prepping for shelf exams. In other words, he asks, apart from my high yield PDFs and QBank, how should you incorporate specific resources for each rotation in order to maximize scores and use those alongside my PDFs and QBank? Okay, a bit of an involved question here, but I will do the best I can. So before we get started, subscribe to my channel. I really appreciate it. Help grow this channel. Share with one of your friends who's prepping for USMLE. Help bring awareness to this channel. Hit the like button. Hit the bell if you want notifications. Find me on Instagram at Mehlman_medical, MEHLMAN_medical. The link is down below. And find us on Telegram. Recently created a Telegram group and channel. The links are down below. Now let me address the fucking question, which was how to incorporate specific side resources with each rotation to maximize scores, in addition to using my high yield PDFs and QBank. Look, I mean, you sort of have the gist already that throughout your clinical rotations, yes, incorporate my high yield PDFs and QBank, do as many questions as you possibly can for USMLE. Of course, I've talked about in many of my other clips, incorporating the clinical mastery series questions as a main component. The CMS questions are the subject-specific NBME questions, surgery, IM, PEDS, etc. Incorporating the clinical mastery series questions as a main resource into your clinical rotations to maximize scores. Okay, so when you ask about like which specific books should you be looking at for each rotation, it's not that I'm going to sit here and name off like 6 different resources you should use for each rotation. My philosophy is that your prep is most efficient and effective when you minimize your resource use. My high yield PDFs, they exist because of the inefficiency that's existed for so long with USMLE prep, that you have resources that are so superfluous, including first aid for step 1, by the way. But I've gone through the NBME content, I've extracted out the highest yield points, and alongside improvising with my 9+ years of tutoring. So you've got my PDFs, you're going to use those with your rotations. You've got QBank, which is just standard to do with your prep, as you already know. And then you're going to do the clinical mastery series questions. Those will help boost your score. For each specific resource, which specific books should you use with rotations? The truth is, it doesn't really matter. Your focus needs to be questions. Okay, questions. Lots and lots and lots of questions as your primary prep for your rotations to maximize scores, which will help you for your 2CK. I understand that some of you are OCD about wanting a tangible resource that you can read. As I said, like a million fucking times, look at my PDFs, okay? And for each rotation, you will have other resources such as First Aid Pediatrics or Deja Review or Pastana Surgery Notes. There are various resources that have been floated as a result of branding. Okay, I mean, that's fine. And you can, by all means, for the sake of equanimity, test out different resources yourself. But I just want you to be mindful that there's a big fucking difference between raw score augmentation, what is actually going to kinetically augment your score, versus just reading resources blindly that feel good, that add a lot of potential energy, just baseline knowledge, but they don't actually contribute to your kinetic score augmentation, okay? So my point of recapitulation is you do not want to over-index on written resources for your rotations and 2CK prep. You need to overwhelmingly over-index on questions, okay? Questions, lots of them, and then you can use my high-yield PDFs alongside. That's it, okay? Obviously, I'm going to make more content. You know the deal. If you like my stuff, subscribe to my channel. And I appreciate your time. That's it.